Hello and welcome to Kinesiology 404, an introduction to epidemiology. My name is Richard Armenta, and I'm excited to be your instructor as we go through this course exploring the field of epidemiology and understanding how the field can be used to help improve the health of our communities as a whole. So today's lecture is going to be an introduction to what epidemiology is, what the definition of the word epidemiology is, and how it fits within the field of public health as a whole. So before we get started, one thing I want you to think about is what epidemiology is as a field. And what does it mean to you as you come into this course learning about the field for the first time? And we'll explore that throughout this lecture and throughout the rest of the semester as we learn about the field of epidemiology, explore how we conduct research about health, and explore how we determine what factors might affect the health of our population as a whole. So for today's lectures, our learning objectives are to first define public health and explore what the field of public health is, define epidemiology, describe why epidemiology is the foundation of public health, state the difference between descriptive and analytic epidemiology, and describe at least 3 uses of epidemiology. So to start out, I want to first give you a definition of public health. And this is quite a lengthy definition, and I'm not expecting that you remember everything in this, but it's really meant to show how interdisciplinary and how broad the field of public health is as a whole. So as defined by CEA Winslow in 1920, public health is the science and art of preventing disease, prolonging life, and promoting health and efficiency through organized community effort for the sanitation of the environment, the control of communicable infections, the education of the individual in personal hygiene, the organization of medical and nursing services for the early diagnosis and preventive treatment of disease, and the development of social machinery which will ensure to every individual in the community a standard of living adequate for the maintenance of health. So hopefully what you'll get out of this definition is that really public health encompasses everything around us, from the hand sanitizer that we use to sanitize our hands from viruses and bacteria, to seat belts that we use in our car to prevent injuries from motor vehicle accidents and protect the health of people while they're driving. And really, the mission of public health is the fulfillment of the society's interests in assuring the conditions in which people can be healthy and live a healthy life. And we do this in many different ways. And there's multiple functions of public health, and those can really be defined within 3 core functions. And these have been defined by the Institute of Medicine. And really those 3 core functions are assessment, policy development, and assurance. With assessment referring to how we monitor the health status of community health problems and of individuals in our communities, and how we diagnose and investigate health problems and health hazards in the community so that we can understand really what's going on with the health, who has disease, when is that disease happening, where it's happening, and so on. Policy development refers to developing policies and plans that support individual and community health efforts. And really what we want to think about with policy development is that we're ensuring that when we develop policies globally and within the United States and within different states and cities, is that all of those policies think about how they're going to impact the health of the communities overall. So for example, if we develop a policy that bans smoking indoors, one, we want to make sure that that policy is based on scientific knowledge that we've developed within the field of public health and epidemiology and medicine, where we, from research, understand that exposure to secondhand smoke can increase cancer rates in people who are non-smokers, but who are exposed to the smoke from people who are smokers. And so when we ban smoking indoors, what impact is that going to have on the health of the community overall? And California was one of the first states to ban smoking indoors, and we saw that rates of lung cancer and other cancers decrease afterwards because of the fact that less people were being exposed to secondhand smoke when they were at a restaurant or a bar or other places where people might have been smoking. And then the last core function is assurance. And that assurance is that public health services are provided to the community. So this might be linking people to needed personal health services, such as medical services, and assuring the provision of health care when otherwise unavailable. What's really important about this is that it's not just about access to healthcare, but it's about access to the right type of healthcare for the right person at the right time. So what that means is that if you have a monolingual Spanish speaker, is that there's an available doctor who can speak Spanish for that person who will help them understand what's going on with their health. Assurance also means informing, educating, and empowering communities and people about health issues. So do we have a proper education system that is educating people from their childhood on about how things like physical activity affect their health, or about how things like smoking impact rates of lung cancer, and so on. And part of this assurance is also assuring that we have a competent public health and personal health care workforce. So we have competent doctors, we have competent public health workers, and more than that, that we're also able to mobilize community partnerships to identify and solve health problems. So what that means is that communities are involved in the process of protecting their own health. And so all of these core functions taken together help ensure that our communities can be healthy and happy and live long lives and have what they need to do so. And this is really the purpose of public health. Let's protect the health of our communities throughout their entire lives. And so now we're going to move on to epidemiology and what epidemiology is as a field. So before I actually tell you the definition of epidemiology and the one that we'll use throughout this course, I want you to think to yourself, what is epidemiology? What have you heard about the field of epidemiology? And before starting this course, what did you think the definition of epidemiology was overall? And so we can really break the word epidemiology down into its different parts, and it's based on the Greek words epi, demos, and logos. Epi is a prefix meaning on, upon, or befall. Demos, it has a root meaning the people, and logos is a suffix meaning the study. So in other words, epidemiology is the study of what befalls the population. But it's really a little bit more complicated than that. And one definition of epidemiology is that it's the science of understanding the causes and distribution of population health so that we may intervene to prevent disease and promote health. And so really, epidemiology is the science of public health. And it's what we use in the field of public health to determine what factors cause different health outcomes in our population. So we can take that one step further, and we can define epidemiology as the study of the distribution and determinants of health-related states or events in human populations, and the application of this study to prevent and control health problems. And what we're going to do throughout this first lecture is break down each of the highlighted parts in blue of this definition to help you really better understand what we do in epidemiology and how we do it. As a foundation of public health, epidemiology is really at the core of public health as a field and what we do to assess and monitor the health of communities through surveillance and identifying health problems and priorities, through formulating public policies based on research that's conducted within the field of epidemiology that has been used to identify local and national health problems so that we can develop policies to prevent those from happening, and to assure that all populations have access to appropriate and cost-effective care, including health promotion and disease prevention services, but more than that, health promotion and disease prevention services that are culturally appropriate and effective and we determine that effectiveness by evaluating those programs to see if they're actually working. If we tell people to go out and be physically active because we know it prevents many chronic health conditions, does telling people to be physically active work? And if not, why not? And what do we need to do to actually get people to be physically active? And those are all things that we can study within the field of public health to better understand how we implement large-scale programs to protect the health of our communities and our populations as a whole. There are two broad types of epidemiology, being descriptive epidemiology and analytic epidemiology. And they're really kind of what they sound like. Descriptive epidemiology examines the distribution of disease in a population and observes or describes basic features of its distribution. So really, descriptive epidemiology answers the questions what, where, who, and when. So what that is what is the disease? It might be diabetes. Where is it happening? It might be that we see higher rates of diabetes in the southern states versus in the western states. Who is getting it? So who in our population has diabetes, and when are they getting it? When is it happening? And kind of when can we see that throughout the last 50 years, we saw an increase in the number of people with diabetes? So descriptive epidemiology is really meant to characterize and summarize what's going on with the health of our population. Once we've done that, then we move on to analytic epidemiology, where we're actually investigating and testing a hypothesis about what's causing disease in our population, or on the opposite side of that, what's causing health? Why are certain people healthier than others? And how can we model that to ensure that all people in our population are healthy? So to do analytic epidemiology, we're really comparing groups of people to each other. And we're comparing the role of different things that we're exposed to, such as pollution, such as environmental factors, where we live, and other things that might impact our individual health and the health of the communities that we live in overall. And analytic epidemiology answers the questions why and how. So why do certain people have higher rates of diabetes? And how is it happening? What's the mechanism, both biologically, environmentally, physiologically, that's leading to higher rates of disease in certain groups of people than others? And so really, epidemiologists solve problems through surveillance and research. And that surveillance and research uses a four-step process that includes data collection, assessment, hypothesis testing, and action. And when using this scientific approach, data are collected, an initial assessment or hypothesis is conducted or determined, and that hypothesis is then tested, and the resulting information is used to take action. This portion of solving health problems illustrates how epidemiologists use each step of the scientific process to understand health. So first, in step one, data are collected about health problems occurring in the population through public health surveillance. That data collection includes information about when the problem occurred, as well as where and who were affected. That is time. So when in timing, is it summer? Is it winter? Is it a certain year? Is it over time? When is it happening? Place, where is it happening? Do we see it happening in one geographic region versus another? Do we see it spread across our entire globe or other things? And person being to whom is it happening? Is it happening more in Black communities or among Latinx communities? Is it happening more in the elderly or the younger? And so on. And so this is known as descriptive epidemiology. That first step is describing what's going on. And then next, we establish inferences on the basis of the data collected, that descriptive epidemiology, and we draw initial conclusions based on that data. And so from there, we use that information to generate hypotheses about what might be causing the health outcome. So for example, if we see more people who are living in inner city neighborhoods developing type 2 diabetes, what is it about an inner city neighborhood that might lead to higher rates of type 2 diabetes in the people who live there? And so we could potentially hypothesize that maybe people in inner city neighborhoods have less access to good quality fruits and vegetables, less access to green spaces and parks where they can go be physically active. And in many inner city neighborhoods, they also have poor education system. So they're less likely to get the education that they need to understand why having a good diet and being physically active prevents things like type 2 diabetes and other chronic health conditions. So once we develop that hypothesis based on our descriptive data that we've collected, then the how and why of a condition is determined by conducting tests or research studies to determine if that hypothesis is accurate. So did we come up with a good hypothesis? And we can test that using research. And in public health, that research is in the form of epidemiology. And throughout this semester, we're going to talk about the different types of studies that are conducted to understand the health of the population. This step 3, is analytic epidemiology that we just talked about. And then finally, once we've tested those hypotheses and we determined causes of disease, and we will actually in this class define what a disease cause means. So what does it mean if we're saying that smoking causes lung cancer? And so that's something for you to think about before we get to that lecture. And once we determine those causes, we take action. We develop policies that say, we know that secondhand smoke causes lung cancer in people who don't smoke, so we're going to develop a policy that bans secondhand smoke. We know that physical inactivity can lead to type 2 diabetes and heart disease, among other things, so we can develop an intervention that can get people to be more physically active. And that intervention could be anything from creating more green space or access to places where people can exercise, to educating people about the effects of exercising overall and what that does for their health. And so these are the steps that we use in epidemiology to solve health problems and understand the health of our communities. And in order to do this, we have a few underlying assumptions within the field of epidemiology. And those assumptions are that illness and disease are not randomly distributed in human populations, and that there are certain things that we are exposed to or that we do as communities or individuals that might predispose us or make us more likely to get some disease or some illness. And that different individuals may have different characteristics that either make them more likely to get illness or that could also protect them from having illness. And so that random distribution of disease, if we had just random distribution of disease in our population, it would make it nearly impossible to understand what affects the health of our communities. And aside from that, communities, neighborhoods, cultures, and populations all have characteristics that predispose or protect them from illness as well. The key characteristics that we look at within the field of epidemiology is that we're focusing on health and disease in a population, and we'll define that in a minute. And this is different from medicine, which most of us are more comfortable with, where the field of medicine focuses on the health of individuals at a time, where typically somebody goes into a doctor because they're sick, and that doctor assesses their symptoms, determines what might be leading to that illness or that disease, and they provide some treatment to treat that. That happens after a person's already gotten sick. Our goal is to prevent that sickness from happening in the first place and identify things that are leading to different subgroups of the population having a higher burden of disease than others, determining those factors that increase risk of disease, and doing that in a very interdisciplinary nature, where we work not only across the field of medicine and public health, but also sociology, statistics, business, policy development, and many different fields. So what's so exciting about the field of public health is that it's interdisciplinary, and that it brings together psychology, sociology, statistics, medicine, and all of these different areas to understand the health of our population. And there are multiple current conceptual movements within the field of epidemiology that we'll use throughout this entire course. And those are the eco-social and life course perspective movements. The eco-social perspective on population health in the field of epidemiology means that We know from research that policies, institutions, and characteristics of context contribute to the shaping of health. Essentially, what that means is that things that we're exposed to in our daily lives, and not just our individual behaviors, can all impact our health. And that life course perspective takes that one step further, where it says that these factors that shape our health are distributed throughout our entire life. And so things that we're exposed to even before conception, that our mothers are exposed to, or our fathers are exposed to, or that we're exposed to while our mothers are pregnant and we're in utero, and all the way throughout our entire life, may impact health conditions and disease that we have today and that we have in the future or may develop in the future. So epidemiology understands causes of population health across levels of influence, from cells to society and across our life course. So this figure just kind of shows what that looks like, where it shows that, for instance, the neighborhoods that we live in, those neighborhoods are drastically affected by, or drastically affect our health because of things like green space availability, things like availability of food, or it not being safe to be outdoors. Where we live, if somebody's homeless, they're more likely to have a number of both mental and physical health outcomes and diseases that makes them in poorer health than people who have stable housing. We have genetic factors that can influence health. There are individual behaviors that influence our health. And so all of these different levels that we're exposed to, even the environment that we live in, that environment that can expose us to pesticides or pollution or other things, can all impact not only our individual health, but the health of the people in the communities that we live in. And so we want to talk about affecting health of a larger group of people. We need to address all these levels of health together. And this is all done within this life course approach, where we can look at this example, for example, what might make somebody more likely to develop cancer at old age. And so if we look at the x-axis being age, as we get older across the x-axis, and the y-axis as it goes up, that means that a person has a higher risk of developing cancer. We can look at things that a person's exposed to during their fetal life, so what their mother is eating, whether or not their mother's exercising, things that she's exposed to like pollution, how the baby is growing in utero, that can all lead to, and even birth weight, that can all lead to and have been shown to be associated with future development of cancer. In infancy and childhood, things like whether or not your mother breastfed you, how fast you were growing and whether or not you were meeting those normal growth expectations, physical activity levels, what you're eating, those all impact your cancer risk throughout your entire life. And we can see these things accumulating throughout our life, where we look at this dark black line and that shading in between the genetic susceptibility, where there is a role that our genes play in the development and susceptibility to cancer. But above that, we accumulate these risk factors throughout our entire life, from our time that we're in utero throughout old age when we potentially develop cancer or before we die, that can all make us have a higher accumulated risk for developing cancer at some point in our life. And so now we're going to move on to break down these different parts of the definition of epidemiology, starting with what does health-related states mean? And so what does it mean to be healthy? And this is something that I think many of us think about health, and we talk about health all the time, but what does it mean to be healthy? So think about that and think about how you would define health for yourself or for your family or for your community members. And so health is actually quite complicated, and it's not as simple as just saying I'm healthy because I don't have disease. Because health is a state of complete physical, mental, and social well-being, and not just merely the absence of disease or infirmity. And health might actually be different depending on who you're talking to. For example, if somebody has some disability, or if somebody has type 2 diabetes or some health condition, to them, health might mean that they're able to do their normal daily activities that they've always enjoyed doing. For other people, health might be that they don't have any current diseases or health conditions. But really what we want to talk about when we talk about health is it's not just about disease, but it's about also quality of life. Are we having good psychological health? So do we have any mental health conditions that we're dealing with or that we need to address? Are we free of pain, of injury? Are we exercising? Are we eating well? Are we doing the things that we love to do? Are we going out with friends and all of these things? So health can encompass any combination of these factors and including things that are not on this list that I'm giving you here. So I want you to think about how would you define health for yourself? How would you define health for your family members? And then the opposite of that is what is disease? So what does it mean to have a disease or an illness? And so there's multiple definitions of disease. And disease is a condition of the living animal or plant body or one of its parts that impairs normal functioning and is typically manifested by distinguishing signs and symptoms. So typically we'll say disease means, I have the flu, and so I have a fever, a stuffy nose, I'm coughing, I have a sore throat, or whatever that might be. And all of those symptoms are defining some disease in a person at a given time. Disease could be that somebody has an injury and maybe they were in the military and they were deployed and they had a blast injury and have an amputation. Or maybe somebody has type 2 diabetes because they lived in an environment where they were mostly had access to processed foods and unhealthy foods. And so that over time has accumulated their risk for developing type 2 diabetes. And diseases can arise from many different places, including infectious agents, stressors, physiological changes, psychological changes, things in our environment that we're exposed to, and so on. And throughout this class, we'll talk about what disease means in individuals, but more than that, because this is a public health class, this is an epidemiology class, we're going to talk about disease stages in populations. And there's multiple different disease stages in a population that help us define what's going on with the health of our population at any given time. And so these three definitions are given here, one being endemic. And if you look at the figure on the screen, endemic is the usual occurrence of disease in a geographic region. Endemic could mean that there's normally no cases of disease in that particular area. So for example, we don't typically see malaria in the United States and especially not in California. And so malaria is not endemic in the United States, meaning that we would typically not see any cases of malaria on a given basis or on any given day or in any given year. When we start to see more than what is normal for a population, and so with that malaria example, in places, for instance, in different countries in Africa, malaria is endemic and they would normally see a certain number of cases every single year. And then when we move from that endemic to epidemic, that's when that level of disease, and if you look at the figure over time, that level of disease starts to occur in excess of what is normal or what's expected for that particular population. So epidemic essentially means, and this is part of the root of epidemiology, is epidemic essentially means that we're seeing a level of disease that's higher than what we would normally expect to see for that particular population. So if we were to have, say, an epidemic of malaria in the United States, that would mean that we'd start to see any number of cases of malaria. An analogous word to epidemic is also outbreak, and this is something that many of you have often probably heard or seen. And an outbreak is just an epidemic that typically happens in one defined geographic region in a very confined amount of time. So we could, for instance, have an outbreak or an epidemic of rabies, where we would typically see almost no cases of rabies in most regions in the United States. And if we see just one case or two cases or three cases, that could become of epidemic proportions. And then the last one here is pandemic. And pandemic is what we see when an epidemic occurs across many regions or populations or even the entire world. So pandemic essentially just means that we're seeing an epidemic in multiple geographic regions. Typically, we think of pandemic as it's happening globally and it's spread across the entire world, but that doesn't necessarily have to be the case. And in order for something to be considered to be a pandemic, there has to be sustained epidemics in multiple regions. So often what we see, especially with infectious diseases, is that we'll see a spread of a disease in multiple populations, but that spread is only happening due to travel, where maybe there's an epidemic of, say, measles happening in South America, and somebody from the United States travels to South America, and their child gets the measles, and they travel back to the US, and there's a couple of cases of the measles as a result to that, but then it stops at those couple cases. That doesn't necessarily mean that there's an epidemic of measles in the United States at that time, because those cases of the measles were brought in by somebody who traveled to another area or region. And so pandemic just means we have sustained transmission of disease in excess of what we would normally expect to see in multiple regions or populations or the entire world. So multiple sustained epidemics across the world. And I already mentioned some other key terms like an outbreak being an epidemic that's typically in a defined area. Another term is a cluster. A cluster is a group of cases in a specific time or place that might be more than expected. So a cluster might be that we all of a sudden in San Diego County see 20 cases of something where we hadn't really seen it. So that would potentially be an epidemic or an outbreak, but it could also just be that all those cases are happening in a really defined region. And so we're seeing a cluster of people in one area getting those. And so we want to understand, why are we seeing that cluster? And one thing we'll talk about a lot throughout this semester is what a rate is. And a rate is the number of cases occurring during a specific period that's dependent on the size of the population during that period. And we'll give some definitions of rates in a couple of lectures, and we'll go through many different rate calculations in this class. And then if we move on to disease stages in individuals, there are multiple disease stages in individuals, including clinical and non-clinical disease. Clinical disease means that it's characterized by having signs and symptoms. So essentially, you have a cold, you actually have a stuffy nose, you maybe have a small fever, you maybe have a cough or a sore throat or something else. Non-clinical disease can have multiple different stages, where you might have preclinical disease, where it's not clinically apparent. So you have the disease, or you have the disease-causing agent, but you don't have signs or symptoms of it, but it will eventually happen and you're going to get it. So that's very similar to asymptomatic, where somebody might be asymptomatic, though asymptomatic can be slightly different because asymptomatic can be preclinical or subclinical, where asymptomatic just means that you don't exhibit symptoms at that time. And so we see often that people might have a disease, but they're not exhibiting symptoms of that disease, and they may never, which might mean that it's a subclinical disease, because that disease is not clinically apparent even though the person has what's causing it. So for example, you get exposed to influenza virus and you never develop symptoms, which many people don't. So it's not clinically apparent and it will stay that way. So you never actually develop a full-on flu or something. And then chronic disease in an individual is one that persists for years. And this can also refer to clinical disease, but not always, because often a lot of clinical disease or chronic diseases may not have symptoms for a long time, and it may take a long time for people to develop symptoms overall. So the next part of the definition of epidemiology that we need to define is populations. So what we're talking about is generally in this class human populations, though we can expand it to also include animal populations, and we'll talk about that a little bit in this class. So we need to define what a population is. And a population is a collection of individuals at moments in time defined by at least one organizing characteristic. And so what that means is that when we talk about a population, that could be the entire population of the United States, that could be the population of California, could be the population of San Diego, Or it could even be the population of students at Cal State San Marcos or another university, or in this particular class that we're talking about right now. Populations have multiple types. They can either be fixed or dynamic, with a dynamic population being one that's constantly changing because people are moving or people are dying or people are being born in that population. Or we can have a fixed population where once somebody becomes a member of that population, they remain a member of that population for their entire life. And that could be something like the fixed population being defined by military status, where once you've joined the military, you will always be a veteran for the remainder of your life. And we'll talk more about those different types of populations in our lecture that we talk about how we calculate different measures of disease within the field of epidemiology. And what's so important about what our population is and who our population is that it has implications for how we interpret data that we collect from our surveillance systems and for how we generalize results for who might be at risk for different diseases within epidemiologic studies. And so we'll talk more about populations throughout the remainder of this semester as well. The next part of the definition that we'll talk about is distribution. So distribution within the definition of epidemiology refers to the frequency and pattern of health events in the population. Frequency being how many people have the disease and how many people have the disease in relation to the size of the population, which becomes really important, and you'll understand the importance of that when we talk about rates in more detail. Pattern being the health-related states or events by person, place, and time characteristics. So that is who's getting it, where is it happening, and when is it happening. And this is all descriptive epidemiology. So we're still answering those questions: who, when, where, and what. And we're trying to describe what's going on in our population overall. And then we could take that further and talk about determinants of health, with determinants of health being essentially what leads some people to have a higher rate of disease than other people. And so determinants in our definition of epidemiology means there's multiple different ways we can talk about it, but it's really we're looking for risk factors or exposures for health-related states or events that are both modifiable and non-modifiable. So these are things that make a person more at risk for disease. So for example, if you're exposed to pesticides because you grew up in a farming town, that might make you more at risk for certain cancers or asthma or other developmental delays depending on your exposure. And so an exposure or a determinant is anything that might affect our health overall. And these determinants lead to health outcomes. And so what health outcomes means is an outcome is the result of some determinant or some exposure that you have. So for example, an exposure or a modifiable factor might be your level of physical activity, where lower levels of physical activity lead to higher rates of chronic diseases. And higher rates of physical activity lead to lower rates of chronic diseases, with those chronic diseases being the outcomes and physical activity being the exposure or the determinant. And outcomes can be defined in two ways: morbidity and mortality. Morbidity means illness due to specific disease or health condition, so that's just sickness essentially. And mortality is death. And so death can be from any cause, and we'll talk about different causes of death throughout this semester. And then the last part of this lecture that we'll go through today is this last part of the definition of epidemiology, which is the application of this study to prevent and control health problems. So one thing I want you to think about is, why focus on prevention? Why do we want to prevent diseases before they happen in the first place? What's so important about that? And so as you mull that over, really prevention is the core of public health and the core of understanding the distribution and determinants of health in our population and of individuals. And so if we can determine modifiable and non-modifiable determinants of disease, and we can say, we know that physical activity is associated with a number of health outcomes, then we want to get our population to be physically active to prevent those health outcomes from happening in the first place. And this level of prevention and preventing diseases before they happen is less expensive, and it's often non-invasive, and it helps ensure that all people in our population have the right to health and can live as healthy a life as possible. And importantly with that, when we do epidemiology and we determine modifiable and non-modifiable determinants of disease, we can identify certain groups of people who have higher risk of disease. So for example, we know that Latinx communities have higher rates of type 2 diabetes. Why? And how can we intervene to stop that from happening so that Latinx communities have the same right to health and are able to live lives free of chronic diseases, including type 2 diabetes, through the work that we're doing. And so this is all done through a combination of population-based approaches and through identifying people who are at higher risk of disease overall. And there are 3 levels of prevention: primary, secondary, and tertiary. And we'll briefly talk about these now, but we'll go through them in more detail later on in this class. And the primary prevention is preventing disease before it happens. Secondary prevention is health screening and detection. So primary is really somebody is free of disease. We're going to do something like give them a place to be physically active so that they never develop that disease in the first place. Secondary prevention is health screening and detection, where we're going to do something like blood pressure screening at community events, where we can identify people who have high blood pressure. And if we're able to do that, we're able to intervene on that high blood pressure through both lifestyle modification by like physical activity and improving diet, and through providing medications to prevent something like a heart attack or a stroke or other conditions as a result of that high blood pressure. And so secondary is really screening for disease before we would have otherwise realized that a person has that disease, and so that we can intervene to prevent more adverse health outcomes from happening in the future. And then tertiary prevention is somebody has the disease, so somebody has type 2 diabetes, and now we want to limit their disability from that type 2 diabetes and improve their quality of life. So that might mean that we're providing education about the importance of them using their insulin properly and a healthy diet and exercise with type 2 diabetes to prevent something like diabetic retinopathy or neuropathy or amputations as a result of diabetes or any diabetic ketoacidosis or any other health outcome. So tertiary prevention is somebody has the disease, we want to prevent it from getting worse. And so to wrap up this lecture, there are multiple purposes of epidemiology, and they're outlined here. And the purpose of epidemiology is to investigate the nature and extent of health-related phenomena in the community and identify priorities, to study the natural history and prognosis of health-related problems, identify causes and risk factors for disease, and recommend, assist in the application of, evaluate the best interventions to help improve the health of the communities, and to provide a foundation for public policy so that we can develop policies that can improve the health of our communities overall. So we'll wrap up this lecture by hoping that you have a better understanding of what epidemiology is as a field and what our goal is to help improve the health of our communities through understanding the distribution and determinants of disease and developing interventions to prevent and control disease before it happens in the first place. Thank you and have a nice day.